morning, good afternoon. Thank you for tuning in. Welcome to our panel discussion. So today we will be discussing Veterans Affairs Path to Innovation with Kontakt.io RTLS solutions. And I'm truly honored to introduce today's panelist. Please meet Jeffrey Saura, the CDO of Emerging Healthcare Technologies Integrations at VA, Greg Merrill, the Program Analyst at VA, Bill Asher, Global Healthcare Practice Lead at Kontakt.io, and my name is Aneta Turkot. I'm the Product Marketing Director at Kontakt.io, and I'll be today's panel moderator. So without any further ado, I'm really excited to welcome our guests and hear more about how the RTLS solutions from Kontakt.io are transforming the patient and staff experience at VA and how it all started. So as one of the largest hospital chains in the US, the VA strives to deliver the best healthcare service possible. Jeff, Greg, you reached out to Kontakt.io some time ago, in fact, prior to COVID, to help VA unlock the potential of the technology you already had in place. So let's talk about this journey. Greg, what was the initial motivation for starting this project? When did you have this aha moment? Now is the time to start interlocation services at your facility in Orlando.
Having our Bluetooth Low Energy, our BLE infrastructure, and looking at its capabilities is when I started to look at what are the use cases? How can I leverage this technology that no one's leveraged before?
Yeah, and I'll add, along with Greg, we wanted to put in, we wanted to improve the customer experience. I mean, don't we all want to do that, especially for our veterans? It's usually one of the top 5 of the VA secretary, and it doesn't matter which secretary. It's improving the veteran experience is always in its top 5. So we thought that by giving a personalized patient experience, by the way of wayfinding and talking to our patients, that would be let's install not just a public Wi-Fi system, let's install a Wi-Fi plus this Bluetooth Low Energy technology that could also provide indoor location services.
There are probably a couple of factors that you had considered. Was cost one of those factors as far as the decision making?
Cost is obviously always a decision maker. Working for the federal government, we have to be good stewards of the taxpayers' dollars. So when we pick a technology, we want to make sure it's cost effective and is in the best interest of what we're trying to achieve and taxpayer dollars. And then there was also the technologies. We wanted a technology that could cross all platforms. We had a BLE technology with a data transport system built into it. We were looking for, a tag that could integrate with our system or any system. We're trying to get away from these individual silos and just go horizontal across the board.
And I would totally agree with Greg here. And the way, instead of these very vertical solutions, we want to take a very horizontal approach. So there are some solutions that are great. You can get full stack. Some, like what we've done here, we already had our own, we had an infrastructure already in place. Kontakt.io provided one of the top of class asset tags. So that's how we came up and married the two.
And our RTLS is, I would say, or interlocation services, it's a quite broad term. What were some of the solutions that you implemented in your facility?
Some of the solutions was a patient tracking system in our community living center to give our veterans a good quality of life so they could walk around the facility and not feel confined, but yet have a bracelet, a wearable, so that, our at-risk patients, we could know where they were at and keep an eye on them. Then from there, we started looking at asset visibility, which is RTLS, We looked at the previous technologies the VA tried to implement. Every technology has its place, but the older technology was maintenance intensive with batteries. It wasn't accurate because it was using older frequencies, and the BLE technology got us, to the accuracy we were looking for. It's capable of 1 to 3 meters, but that was not our objective. Our objective was zones. A room might be a zone. Let's find that tag to that zone so we could get reliability and repeatability without it on the dashboard bouncing around.
Yeah, I think that's right, Greg. I think that as I was always looking at this patient-facing wayfinding experience or geofencing, to personally speak to our customers in their handset, you have always been after that asset visibility, not which is different really than the RTLS. You're not looking for the pencil. You're looking for what zone can I find this asset in.
And elaborating a little bit on asset tracking solution or the use case, let's maybe inform our audience about the types of assets that you're tagging, because I think it might vary from hospital to hospital. It can be an IV pump, wheelchair, vacuum. What were I would say the key items / assets that you were tagging?
It's basically come down to obviously our IV pumps, beds, ventilators, wheelchairs, mainly equipment that's mobile and on wheels, and believe it or not, vacuum cleaners for the cleaning staff. It's not that a hospital loses equipment or it magically disappears. It's just one person uses it, puts it away, and doesn't tell anybody else, and then you think you're missing something, and then you spend money buying a replacement when you didn't have to. And then plus it helps with the staff that maintains the equipment being able to find it in a timely manner so they can perform the maintenance and get it back into operation.
I think you hit the nail right on the head there. It's making it very much more efficient to find it and to be able to use it instead of an inventory. I mean, there's just so much to be said for those assets, and I think there was a list of high value assets that were considered. I think that we considered it in sections. There's high value assets, then there's these mass assets that are on wheels. So there's a few, I think 3 categories that we place them in, and each one you have to consider because the tags, it makes a difference in the tag. If it's a stationary object, that's sort of one tag, right? And if it's something that's rolling around a lot, that requires a different tag. And the high availability, you want the alarms to sound if it gets walks out your door.
I would, Anera, if you will, I would like to chime in a little bit here. Just from even outside of VA, right? We have a bunch of private hospitals, community hospitals. Most of them kind of have the same challenge, right? Which what VA is facing right now. Mobile equipment, they have legs, they walk around, they don't stay in one spot. And sometimes nurses are trying to do the right thing, but if they don't get the equipment that they want for their patient care, the complaint just bubbles up all the way to the CFO. And the easiest thing to do is let's go buy more equipment, right? That's the simplest simplest solution to the problem. Let's go buy more equipment without kind of realizing that it's not a problem of the quantities not supplying the demand. You have enough in the hospital. The problem is just where are they, right? So if you put some visibility, like by tagging those assets and by making sure there is a pulse on where they are at any given time and improvising some of those workflows, you could avoid this duplication of buying new equipment. You can kind of just have a pulse on where things are, define a nice way of distributing them and collecting them after the patient is done. you could improve your current utilization from 30, 40% all the way to 70, 80%, and kind of minimize this duplication purchase and get your ROI on an RTLS system within kind of 4 to 6 months, I would say.
So I know everyone is tired of talking about COVID, but Greg, did the pandemic affect the urgency of the project? We know you started before COVID, but did the event stop you from the implementation, or the opposite, actually accelerated it?
I would say it accelerated it, because we realized then when we needed things urgently, such as in the very beginning, it was ventilators. It was nothing, we didn't have the system in place yet, and we could not find our equipment. We knew we had it. Our inventory said we had it. We just didn't know where it was. So that pushed the urgency forward and on the implementation as a whole.
And I think
I would say you have pre-pandemic, post-pandemic, right? So the pre-pandemic, you're doing this, you're on a roll of this asset management, and then you've got this pandemic that I think we'll all agree is something very new to us. So you've introduced now this social distancing and hand hygiene. Both can be solved or improved with geofencing and indoor location services. And finding equipment becomes very important to find a ventilator. And where is that ventilator? And let's get it in use when you need it.
Right. I'd like to chime in just a second over here, but when we were in the heart of 2020, I think things that we had never thought of before from an asset tracking standpoint came to light, like HEPA filters, right? HEPA filters, you knew what they were and why they're being used, but now all of a sudden it became a very important commoditized item that was required in COVID rooms, right? So I remember having discussions with multiple hospitals about tracking them and kind of adding a workflow to them as well. Obviously, once you leave a COVID room, there is some reprocessing required. What if it goes from one room to the other without the proper sanitization and things like that? So RTLS can help with those things, right? It can provide an alert if it goes to another room without proper cleaning processes and everything. And of course, that's more for the COVID times. But if you just take it from a normal acute care, like Jeff mentioned, hand hygiene, making sure the equipment is sanitized correctly, that all adds up to reducing HAIs, hospital-acquired infections, which obviously have a lot of benefits from reimbursement standpoints, from HCAP scores, all of those things.
And I believe many hospitals were hesitant to test the technology during COVID time. So I think as far as VA, it was great that you started testing it prior to COVID, and you were ready to actually start utilizing the technology once COVID started. So I think it's great that you saw this potential and the opportunity for both patients and staff, and how it can deliver positive outcomes. So we're hearing, and probably you can read it pretty much everywhere in the news, whether it's news from United States or somewhere in Europe, hospitals are having turnover staff members. What is VA thinking about staff retention and attracting new talents? Is technology that you have implemented at VA helping here?
Yes, by having that technology in place, the clinical staff, they realize they have a big enough workload to begin with. Having to find equipment to get their job done makes it difficult. If they can see that, we're trying to make their life easier, more efficient, so that they can focus on the patients and not have the added stressors, it hopefully helps in retention of our good employees and attracting, quality employees.
Yeah, this is an interesting question, because I really haven't thought much about that. How are we attracting? If this technology attracts new talent. But I mean, in my mind, it says it certainly would, as Greg just explained. But it would be something that we should look at monitoring and measuring, and maybe it's something a simple survey, because this technology is in place. How does that make that feel? And we can work with some of our national offices. I think that's an interesting question, so I'm glad you asked it.
Today we're talking about RTLS, but primarily we're talking about Bluetooth Low Energy based RTLS. And as we know, Bluetooth Low Energy based RTLS wasn't the first technology you implemented. Greg, what was the previous technology you used and what were its shortcomings?
Previous technology was 900 megahertz based technology. And the tags, battery driven, but because of that technology, had a high battery maintenance. Battery maintenance was being reported as being high from other facilities. And 9 megahertz had a problem with hopping from, the tags would hop, what we call hop, from floor to floor. So on the dashboard, it might show a tag on the second floor when it's actually on the second floor, because it would bleed through with the zones. Whereas with Bluetooth Low Energy, it can lock it down to that 1 to 3 meter area, or in our case, into that zone without hopping from zone to zone.
And as far as, so you mentioned hopping, which I think has a little bit to do with the accuracy as well, and the use cases or solutions that you mentioned earlier, patient tracking, asset tracking, and wayfinding. Those are some of the solutions that require, I would say, pretty accurate technology, and pretty accurate is quite general term, so we can even call it zonal or room level technology. Was accuracy one of the issues that you have encountered with the previous technology?
Yeah, in the previous technology, the tags aren't adjustable. They just work at a certain rate and a certain power level, and that's it. With the new BLE technology, you can adjust the power level and the beacon rate. So as Jeff mentioned earlier, if something's not mobile, it doesn't need to beacon that often. But if something is on wheels, it needs to constantly beacon so you can track its movement throughout the hospital. And with the BLE technology, you can do all of this off of a thin battery and still get a 3 to 4 year battery life out of it.
So I can, thanks, Greg, that was very insightful. And I can kind of explain why you're observing some benefits out of BLE that you were not able to benefit from your previous technology. So Bluetooth Low Energy, the word itself is very self-explanatory, low energy. It's a very low power consuming protocol. If you have your phones, keep it on Bluetooth and turn off Wi-Fi, you would have multiple days of battery life. But as soon as you turn on Wi-Fi, you have to overnight charge it, right? It's just a more power hungry protocol compared to Bluetooth. So that explains why our tags have a greater span of battery life. No matter what tag it is, an asset or a staff or a patient tag, we have a constant improvement on battery technology that is served by the low energy protocol that BLE has, right? The second is, what that does is it improves your ease of deployment and ease of maintenance. So you're not sending out labor to go frequently replace batteries every 2 years, and you can span that out for a longer period of time. The second one is kind of open source nature of BLE, right? So Bluetooth is in pretty much any consumer electronics goods you can think of. It's in my AirPods, on my phone, my computer, my car, my sneakers, right? So it's in about 6.5 billion consumer electronics goods right now. So you can imagine the amount of massive R&D that's going into Bluetooth. And we are leveraging all of that. So without much spend on R&D from our side, we are leveraging all the chip manufacturers' R&D and just putting that into our products. So it constantly gives us that cost benefit, because as things expand with volume, the costs come down. and also from all the engineering that goes into improving its performance, low cost, low size, small size, as well as better battery efficiency. So I think, and then the third point is from an openness standpoint, we are able to integrate with any Bluetooth manufacturer in the world, right? So because there are open standard protocols, they have the same frequency of operation, they have similar packets that they transmit. We can integrate with any other IoT sensor that is using Bluetooth within our platform. So it doesn't monopolize you. You don't get stuck or pigeonholed in one technology. And now maybe you found a better tag that helps your niche application. You cannot integrate that with an old legacy technology. But with Bluetooth, sure, you just bring that on the platform and we'd start tracking it within our cloud.
And I think, Kapil, this is a great summary of benefits of using BLE technology over any other existing RTLS technology, especially within the
if you hadn't stopped me, I would have kept going, but I know we are on a tight budget.
We have the same problem.
Greg, as you decided to move from the previous technology to Bluetooth low energy based technology, what stood out for you as far as selecting Kontakt.io? What were some of the reasons why you selected us over other players in the RTLS healthcare industry?
It's as Kapil mentioned, the open architecture, open API. It could integrate with our existing BLE infrastructure and the adjustability of the tags, for the power and the beacon rates, and we can use it with the open API with any infrastructure that we might have in this building. We did not want to get locked into something that was proprietary.
So thanks, Greg. I think our audience will appreciate those answers, as they are probably moving from old, I would say, legacy RTLS technologies to newer versions of technologies such as BLE. So that's definitely helpful for our audience to make this decision. So once you implemented the technology, as with any other project or technology, you want to measure its success. What is your standard for success for this project? Is there a particular metric that matters most to you? Correct.
For me, it's time saved. So staff can be more efficient, finding equipment, maintaining and getting the PMs done in a timely manner. Saving money so you're not buying duplicate equipment unnecessarily. You spend so much money on just looking for equipment or buying equipment. If we could save money there, that's one way to measure the success.
Jeff, would you add anything?
Yeah, I would say I can give you the really scientific, right, measurement, and then I can give you the Jeff Saura kind of my style measurement. All right. So the scientific measurement is we did take in, we put in an infrastructure in the National Simulation Center, which sits on the same property as the Orlando VA Center, but it's our National Simulation Center where we teach, I think 75% of all physicians. It's a teaching institution, but it's also a place that Greg and I would test out technologies. It's basically a 50,000 square foot building that is a replica of a 1 million square foot hospital. So we outfitted that with infrastructure of BLE, and then one of our engineers that was on our team at the time went in and he measured. He used tags and measured. He did measurements. One of the measurements I recall is tagging a mannequin and then rolling that mannequin over to see if we could still see a signal while a patient is sleeping at night. And he came up with these really scientific measurements, and then this is what he did it real well, and his focus was definitely on patient safety, all about patient safety. Now for me, again, focusing in on that patient experience, I look at it and say, all right, I put this new personalized patient experience out. And when I have people calling me from across the country, or people from my region saying, regional directors saying, can you please do this in our hospital as well? Can you, do what you did here, do it here? Or fielding calls, sometimes ridiculous, across the whole enterprise. Who do you call when you want to talk to about this indoor location services and wayfinding? If it's wayfinding or patient experiences, there's no doubt that people say, oh, call that guy Jeff Saura. So that tells me that we're doing something right.
Yeah, that's the best validation you can get, right, from your peers in other parts of the organization. If they're noticing and wants to talk to you, I think that's the best validation you can have.
And I think it's also the best validation for our technology. Other hospitals following up on the success of VA or other Kontakt.io healthcare customers. So I think we're kind of aligned on similar success metrics here.
Yeah, and VA holds the torch for technology adoption in this industry, period, right? I think that's what is so important about this discussion we are having right now. Like if VA is doing something, then other hospitals will take notice.
Absolutely. So Jeff, what are the nice to have things VA would like to achieve with this technology?
I'll give you an example of a nice to have that one of the quickest things that went to a must have. So and let's get back to pre-pandemic, right? And we were mostly focusing pre-pandemic on this patient experience, patient-facing, wayfinding, geofencing, being able to talk to our patients, right message, right person, right time, by using geofences. Post-pandemic or during the pandemic, we were acutely aware that I didn't even know what social distancing was. but now you've got the social distance. You got to stay. You got to measure how far you're away from somebody. You can't do that without an indoor location services or positioning system, right? Hand hygiene, right? When I was taught, my mother was an infection control nurse, so I was taught, wash my hands and sing Mary Had a Little Lamb or something like this, right? But there's actually a number that the CDC puts out that says, all right, you have to wash your hands for, I guess it's 20 seconds. Sorry if I got that wrong. Not for you medical people, but you can do that. You can monitor. Now you can monitor and measure these kind of things. So I really think indoor location services, the technology we're talking about today, was one of the fastest things that was an emerging technology when we jumped into the business, when we got into what we wanted to do, to where we're at today. So yes, that's why for all those reasons, I think it's a must-have.
And with this technology that you have in place today, where do you see the role of RTLS or UCLS going in the future in your Orlando facility?
So our RTLS, let's talk about the RTLS part. VA does have 60 facilities using RTLS and some of the technologies that were discussed before. We have 178 facilities. My feeling is that the VA is going under an electronic medical records modernization project right now. And that'll put the VA's EMR, or electronic medical record, on par with DOD's EMR, right? So that's a big initiative that's very important, right? Following our soldiers from active duty onto the VA. But I think with this new infrastructure is going to give us more opportunities for maybe a cohesive, the newer technologies that for RTLS and a more cohesive across the enterprise itself. And it's interesting. So this UCLS, utilization conditioning location services, which I think is the evolution of RTLS, is something that Greg and I played with a prototype early on. Of course, we didn't get far with that because it's an emerging technology. It's much on top of my mind, but I'm interested in where, and to ask a question from a question, if I may, I would like to ask Kapil where your roadmap is where Kontakt.io's roadmap is on UCLS techs.
Yeah, Jeff, that's a great question. I think, and there was a hint in what you said in your answer over there, right? So RTLS is evolving into UCLS, right? So RTLS for now was just about location. Where's the location? Whether an asset is in a patient room or in a closet somewhere. That was kind of where the buck stopped with RTLS. And not to anybody's fault, but that's all the system in a legacy environment, that's all the system could support is location. But that's where Bluetooth comes in, right? So that's why BLE Bluetooth is so important, because it's so cheap that medical device companies are starting to put the chip inside their devices just because it doesn't cost them anything, right? So now it is up to Kontakt.io to harness the power of BLE, which is already in medical devices, and to provide and to extract data out of them, obviously in a secure manner, obviously in with all compliance regulations that are out there with such kind of integrations. But now at least the infrastructure is there, the platform supports the integration, as well as now the devices themselves have the ability to speak with the platform because of their Bluetooth. So, not that I have an answer for where it is going right now, but all the pieces of the puzzles are in there. Now we just have to put them all together, right? So some examples of what I can think of is if there is an error notification on a device, right now, probably your nurses are looking at the display, entering a ticket, and then someone from Biomed comes out and picks it up. Maybe the device themselves can open a ticket directly into the Biomed systems that, I have this error, I cannot function without it, please come and fix me. And here's my location. This is my real-time location. So those are kind of some of the things to improve the downtime avoidance, to improve repair and maintenance. All of those things are kind of where we are thinking from a roadmap standpoint.
Excellent.
And
Nice to hear.
And I think this is a perfect time to mention to our audience to stay tuned with what Kontakt.io is working on. Follow us on LinkedIn to see all of our upcoming announcements. But sticking with the topic of the future, Jeff, we typically notice our healthcare customers expand into other use cases. They start with one and then the other naturally follows, such as staff duress, patient workflows optimization. Is this on VA's radar as well?
Yeah, I think we're all thinking about staff duress and how I think it once you have an infrastructure and you've tried a few things, I think that's why I always refer to indoor location services instead of just positioning, because there's so many services that come to mind, and I think once you have that indoor location service, I mean, immediately, like I was talking about the pandemic, social distancing, you can now measure that. We can put up a dashboard, what's been clean, what hasn't been clean. So I think and trust me, the VA does have a wonderful innovation unit, an innovation team. But the VA enables innovation, right? Most of that innovation comes from our staff. So I think once they see one thing, then it's not coming from Greg or myself. It's really the ideas that come so we're enabling it, and we're enabling innovation rather than innovating. So I think the really great ideas come from the staff that are working in there, right? Yeah. And then there's traditional accelerator programs, Spark, Seed, Spreads, Shark Tanks that the VA does, but yeah, those that's what I think is the future.
And on behalf of Kontakt.io, I can say that we're honored to be part of this innovation story at VA. So thank you so much, Jeff, Greg, Kapil, for being with us today. We can't wait to have yet another session talking about future successes within VA. I don't believe this is the end of the story. So once again, we appreciate your time. Thank you for joining us today, and we'll see you next time.